Coming up in the news, health officials confirming the Omicron variant is on Grand Bahama. Also, the Ministry of Health and Wellness introducing new contact tracing protocols for COVID-19 cases. And a man charged in connection with the island's latest murder. The Bahamas Tonight, the Northern Edition, starts now.
This is the Bahamas Tonight, Northern Edition.
This is the Bahamas Tonight, the Northern Edition. Good evening, all. I'm Jamila Mizik. Thank you so much for tuning in. Topping news tonight, health officials confirming today that the latest strain of COVID-19, Omicron, is in Grand Bahama. The acting clinical director for Community Health Services says they have tested several samples and received positive results. Renewal Knowles reports.
The newest variant of COVID-19, Omicron, which was first reported on November 24th, 2021, is in Grand Bahama. And acting clinical director for Community Health Services at the Grand Bahama Health Services, Dr. Stacey Bevins-Lang, says the Omicron variant has proven to be highly contagious.
We have to remind everyone, too, that yes, we have Omicron, but we also have Delta still around. And as we know, Delta was a rather dangerous strain. It would have placed numerous persons in the hospital. So that is why we're asking persons to please be vigilant.
Dr. Bevins-Lang says Omicron is affecting all ages.
The persons who are more at risk are kids, pediatric patients, our elderly, and our immunocompromised persons that have cancer, who are on chemo, diabetics, hypertensives, who are not controlled, asthmatics, those HIV, those persons.
She explains the symptoms health officials have been experiencing in pediatric cases.
The kids tend to present with vomiting, diarrhea, maybe simple flu-like symptoms. Most cases, these symptoms are only lasting maybe 2, 3 days, 4 days maximum. It's so mild in some cases that most parents don't even think much of it. However, there are persons who would have had their kids tested, and most of which have come back positive, and this is with the rapid testing.
And now that preschools have resumed classes, she is admonishing parents to be mindful, especially if your child is presenting the following symptoms.
If you notice that your child has runny nose, vomiting, diarrhea, sneezing, coughing, please keep them at home. Preschools, in most cases, would have resumed classes as early as today. We are asking that if your child has any symptoms, please don't send them to school, because kids are not wearing the mask like they're supposed to, and therefore the whole school can be infected within a matter of days.
Thankfully, she says, the symptoms in children are mild and will subside on their own, but she adds that it can also be treated.
What we ask the parents to do is, if the child has a fever, they give them Panadol or paracetamol. Now, you can also contact one of your local clinics or your private physician, and they will tell you exactly how much to give. For persons who have a cough, for those kids that have a cough, we do not recommend cough medication, so please don't go and just start giving your child cough medication. The cough will subside on its own. Now, if you notice the cough is going for numerous days and it's getting worse, not resolving, contact your physician.
In addition, she adds that it is important to keep children hydrated with water or Pedialyte. Renewal Knowles, ZNS Network News.
Meanwhile, as the Bahamas continues its fight against the COVID-19 pandemic, the Ministry of Health and Wellness introducing new contact tracing protocols for COVID-19 cases due to the increasing number, of positive cases of COVID-19 reported over the past several days. Effective January 1st, the surveillance unit will contact individuals via SMS messaging, notifying them that their results have been reported to the Ministry of Health and Wellness. The message will contain instructions to follow while in quarantine and a link to a form where additional information will be collected, including the contact information of persons who may have been exposed to the positive person over the past 2 days before testing. A second message will be sent to provide telephone numbers to contact for further information and to answer any questions. Meanwhile, 477 new COVID-19 cases recorded on the dashboard for January 2nd. The new data reflects 410 cases in New Providence, 14 in Grand Bahama, 12 in Abaco, 1 in Bimini and Cat Key, 6 in Eleuthera, 3 in Exuma, 1 in Inagua, 1 in Andros, and 29 locations pending. 30 of the new cases are persons who have a recent history of travel. There are currently 3,203 active cases. 43 persons are hospitalized, 3 of them in intensive care. The death toll remains at 717. In other news, the Rand Memorial Hospital is reporting a significant increase in the number of persons presenting to the emergency department with flu-like symptoms. Given the current status of healthcare in the country, officials are admonishing persons to utilize the surveillance units and community clinics. Ramiko Knowles has more.
Headache, fever, body aches, and sore throat are all symptoms of the coronavirus and also the seasonal flu.
Anytime anyone are faced with these symptoms, the first thing that comes to their mind is whether or not they have COVID.
Medical Chief of Staff at the Rand Memorial Hospital, Dr. Freeman Lockhart, says that persons experiencing those symptoms are arriving at the hospital in numbers that far exceed the hospital's capacity.
So we are asking persons to pretty much come to the hospital if you have shortness of breath. Shortness of breath is the symptoms or that we are very, very concerned, that we are most concerned about. And that should pretty much land you in hospital. Or if you have an extremely high temperature that doesn't go away.
He says that persons experiencing general flu-like symptoms should contact the community surveillance unit.
You can call the surveillance team and you can get some advice from the surveillance team. You can even have go and get tested from one of the facilities in the community if you're concerned.
He notes that it will alleviate the strain on the healthcare system.
Keep in mind, even though we have COVID, there are non-COVID patients still coming in. Patients are still coming in who are having acute chest syndrome, that is chest pain, difficulty breathing for non-COVID related reasons that need to be seen. You're still seeing stroke patients, and these patients absolutely have to be seen.
Now, in addition to the surveillance unit, he says persons can also see physicians at the community clinics.
There's a clinic right here in the building we are in that's here all during the day. Hawksbill Clinic, all of the other peripheral clinics in their community. They can go to those and see the physicians at those clinics, and they can be equally dealt with and advised, and basically their condition can be established. So clearly, the messaging here is that you want to basically come to the emergency room for true emergencies.
Now, health officials maintain that vaccination is still the best method to fight against the different variants of COVID-19, in addition to following the safety protocols, such as wearing of masks, proper social distancing, and frequently washing your hands. Ramiko Knowles, ZNS Network News.
Now, for persons experiencing flu-like symptoms, you can contact the Grand Bahama Health Services Surveillance Unit at 807-6634. In other news, at the beginning of a new year, many people set out to make resolutions in hopes of improving the quality of their lives. Tonight, Sabrina Brown talks with a life coach about how best to follow through on achieving your goals.
Corporate trainer and life coach Deborah Pratt says, at the beginning of a new year, whether or not you make New Year's resolutions, we should all set goals.
In order to be able to achieve those goals, it definitely depends on our mindset. We have to determine within ourselves. We have to be intentional about wanting to achieve those goals. So when we talk about mindset and renewing your mind, that is so important because as the Bible says, as a man thinketh, so is he. So we need to learn to think positively, have a positive attitude, change our minds. Instead of thinking, well, I don't think I can do that, I cannot do that, we need to learn how to renew our minds.
Pratt is also cautioning persons to be careful of the things they spend time focusing on.
There's a computer term, GIGO, G-I-G-O, garbage in, garbage out, implying that the information, that data that is put into the computer, if you put garbage into the computer, that is what you expect to come out. So in renewing our minds, we have to make sure that we don't allow so much garbage to get into our minds as well. Garbage gets into our minds by the things that we may read, the things that we listen to, the things that we hear on a daily basis. Sometimes if we are honest with ourselves, we would realize that the people that we hang out with, they are persons that really drain us. Some people are really draining. They are just complaining all the time and never trying to do anything better or make anything better. They are always complaining.
She has this advice on ways you can renew your mind as you chart a new course for the year ahead.
We have to ensure that we read a lot. You know, you want to make sure that you take in a lot of positivity, whether you read the Bible, whether you read those motivational books. You want to ensure that you listen to a lot of positive things. If you were driving in your car and you just want to put on some inspirational message or something, we have to make sure that we have to be intentional about wanting to improve our lives, and therefore we must improve our minds by ensuring that only positive things go in. And we all need it, because even myself, even as a motivational speaker, as a trainer, and loving to empower others, I too need that daily reminder as well. I need motivation as well. I need encouragement. So I would always try and listen to something positive as well, just to keep me going. So all of us need it.
Sabrina Brown, ZNS Network News.
The Ministry of Social Services and Urban Development issuing a statement on terminated urban renewal employees. The government has now settled with all 65 former employees of urban development in Grand Bahama and the Family Islands who were unceremoniously terminated after the May 10, 2017 general election. The release continues that in letters of termination, the employees were promised the requisite allowances. These allowances were never paid, and the matter was subsequently taken to arbitration at the Labor Tribunal. In consideration of all the circumstances and upon recommendations, the government, through the Ministry of Social Services and Urban Development, settled the outstanding issue on December 31st, 2021. Stay with us. There is more news right after this break.